Today, the White House announced President Trump has been diagnosed with chronic venous insufficiency after he experienced some issues with leg swelling and noticeable hand bruising recently. Tonight, I'm joined in studio here by Dr. Hassan Al-Dalami. He is the Network Director of Vascular Surgery at Honor Health. Thank you so much for joining us in studio.
Thank you very much for having me.
Okay, so I've never heard of this before. What is chronic venous insufficiency?
It's actually quite common. Somewhere between 10 to 30% of adults in the United States suffer from chronic venous insufficiency. It's when the veins in our legs are not as effective as they need to be at returning the blood back.
Okay, so how serious is this?
It isn't really. Like I said, it's very common. Most often it's benign and easily managed with conservative therapy. On occasion, some patients may need some minor office-based procedures.
Okay, so the White House mentioned that the president had some leg swelling, some hand bruising. I think we've seen pictures of that on social media going around where his hands look really dark on the top and then, his ankles swelling. So how typical are the symptoms that we're seeing from the president?
Sure. So I think the hand symptoms are different from the leg symptoms.
Okay.
So the hand symptoms they mentioned were bruising due to aspirin, and that's true. That's something we do see. The leg symptoms were diagnosed separately using a vascular ultrasound.
Okay. So, is this common for someone the president's age? He's 79 years old.
Yeah, absolutely. The incidence of venous insufficiency increases as somebody ages, and it's very common in folks above the age of 70.
Okay, so what's the worst that he could be experiencing?
Again, like I said, it is common, it is most often benign, and it exists on a spectrum.
Okay.
So the majority of patients will have some varicose veins, extra veins that we see, some amount of swelling. On rare occasions, if the disease progresses, patients can develop skin ulcers or wounds that are troublesome and difficult to manage.
Okay, so could this limit his ability in any way? To perform or?
It's hard for me to know where on the spectrum his condition is, but from whatever information we have, it seems like it's just leg swelling, so that means he's very early in the disease process.
Okay.
And therefore, I would be surprised if it would limit him in any way.
All right. Well, the president had a physical back in April, and according to his doctor, he was in perfect health. So should the public be concerned at all about this recent diagnosis?
Again, I'm not privy to all the details. In general, chronic venous insufficiency is not something that one would need to worry about.
Okay. Well, that sounds pretty good. I like that.
Thank you very much.
All right, Dr. Al-Dalami, thank you so much for joining us here in studio.